we couldn't have a new beginning till we had a new leader, and that is what we have in Dr. Owen.
Bill is a new beginning in the life of the institution. Even though we are several decades old, we feel like a new entity.
We're really taking to heart this idea of new beginnings. And everything that's gone on in the past has gone on, and we're going to keep chugging away and making things better every day.
I've known pretty well every president of UMDNJ since its inception. But he brings a much broader background of medicine and politics and community activity, community participation, than any of his predecessors.
By the virtue of his coming, there was just enormous hope because we were turning a corner as a university. Really that sense of moving beyond the very difficult times that we had just been through.
Dr. Owen emerged as a very clear leader with vision and mission, with really significant core ethical values that he was going to bring to the table.
He brought a very down-to-earth relationship style that started to pull people together, and I think that's what we needed at the time.
I was told UMDNJ in the past was looked at as a holding company for 8 individual schools, and I really don't feel that way anymore. There is more coordination, more interaction, more entrepreneurial approach to this university than I've ever seen.
I've been fortunate to sit on a number of university-wide committees, and there is a collegiality that I've never seen before.
The deans meet all of the time. I think we see each other every week, so we know much more about each other's schools and what we can share together.
There is this sense and culture of collaboration across the campus, and we're going to rely on that more and more, because as research gets more and more difficult, more and more complex, we need more team science.
You don't only see medical students and residents, you see nursing students, you see MA students, you see physical therapy students, and we work together.
Both at the Environmental Institute, the medical school, the School of Public Health, all of it together. We really are able to formulate a big collaborative group that we can do a lot of work that other places may not be able to.
I was part of the search committee that was looking for the president, and one of the things that impressed me about Dr. Owen was his knowledge not just of medicine but of all of the health professions.
You have to remember, he's a nephrologist, so he was required to work with nurses and social workers and dietitians, so he sees and understands the value of a team.
I remember interviewing a number of individuals who were in the class of 1980, so I remember well when that class was coming in, and I can recall Bill, as we called him then, being immediately recognized as one who was going to be a leader in that class.
I met Bill Owen the first time as an intern at the Brigham and Women's Hospital. I met him because his mother was a dialysis patient, and that was my field of specialty, and Bill had come to ask me questions about his mother's care.
He had his usual smile and his usual energy, and he even had a game plan, which many postdoctoral fellows do not really have.
I think there has been great purpose in Bill's career path. He left the Brigham, went to Duke with an excellent opportunity to run the renal division there. From Duke, went to Baxter Laboratories, where he was a head of research at Baxter Labs.
When it came to sort of working in industry, it was like a duck to water with Bill. He just had the sort of the natural skills that not a lot of people have to make that transition.
And we expected that he would be able to take what he learned at Baxter and at the University of Tennessee, combine the two, and be able to develop a plan, a strategic plan for UMDNJ, and he's done a great job. He hasn't disappointed.
Bill has, through his corporate experience, brought a different way of handling issues into this institution. People who have been involved in academics for all of their life are not familiar with the way the corporations work, and that's made a big difference here. And it's taken a while for us to understand what that means and how to operate within that structure, but that's beginning to work.
I think that experience has served him well. It's always good for a public official to have been in private practice, so to speak, so that you understand the world completely.
We had a physician scientist also with a background in business. That's a very, very rare combination.
Bill is a champion of the underserved, of the patients that don't move in our medical systems with great ease. This is an important thing that he does.
He and I have had many conversations about specific patients and the challenges and issues and complaints and questions that they raise, and talking about, you know, what is different about this particular patient, why did they have the experience they had. And I think it's easy sometimes to care about patients kind of broadly and conceptually, but to really be interested in what happened to one particular patient at one particular point in time really says a lot about the person who's asking the questions.
Dr. Owen is someone who clearly, when you meet him, he puts you at ease, and you sense leadership when he's in the room.
If you have a good idea, he wants to hear it. If you have a real problem, he wants to hear it. If there's something that he's doing wrong, he wants to hear it. And to me, those are marks of people who become great leaders.
His leadership style has come to us at a time of great need in the history of UMDNJ. And his leadership style has been transformational.
When he arrived, in my view, the institution was on the road toward decline. Why? Because there were so many things going wrong, and the media was never reporting on a good story. Everything was very negative. Since Dr. Owen has been there, even the media has reported some good stories.
We had the occasion to celebrate U.S. News and World Report, ranking us in the top 50 hospitals in the country in cardiac care and respiratory care. President Owen thought that was important to celebrate for the university and the hospital. That was a great new beginning.
Our applications have risen at twice the national rate, and I think that's a statement with regard to the quality of our program.
New Jersey Medical School is clearly in a better place.
He even has an office here on the Stratford campus, which I've never known any previous president to have an office here.
I tell you, it might be hard to believe that someone with Bill Owen's academic accomplishments is not an egghead. We actually live in the same neighborhood, and I was walking outside one day and I heard this tremendous roar coming down the street and was scared out of my wits. I turned around and lo and behold, it was Bill Owen on his modified motorcycle chopper riding down the street in all his glory. It is a beautiful, red, custom painted, high handlebar, low saddle, long motorcycle with a portrait of his beautiful wife on the gas tank, and I was just shocked.
The man is charming. He has a great sense of humor and a really bright, happy laugh as he listens.
Bill has a very disarming smile, and he's got that southern gentleman's charm, but don't let that fool you. He's tough.
I can't think of many obstacles that might throw Bill. In fact, I can't think of a single one that might throw him or might put him off course.
The way that he performs his job, he has it down to science, and things seem to get done when I always think, how's he going to accomplish that?
Every institution he's been in has benefited from his presence. New Beginnings is what he is about.
We are truly excited about what tomorrow will bring.